If it weren't in an exam room at Sanford Health in Jamestown, North Dakota, you might think Tony Hagan and Dr. Bradley Skari were just two friends shooting the breeze. They talk about family and their personal lives, and of course, they crack jokes at each other's expense.
Seems like you're getting shorter.
Yeah, well, that's shorter and bolder.
But these two have a very different, very serious type of bond.
I trust him with my life. That's how I feel about this man. He's done amazing things for me.
In 1992, Hagan was diagnosed with Hodgkin's disease, something he believes was a result of inhaling farm chemicals and fumes as a truck driver. Hagan was also a heavy smoker. So with a history of cancer and cigarettes on Hagan's resume, Dr. Skari recommended annual lung cancer screenings.
Any cancer can come back, which is why it's very important that we follow up on these CT scans. Lung cancer is notoriously awful because when it's found a lot of the times it's stage 3, stage 4, which is very difficult to treat. By doing these scans on a regular basis, up to 15 years quit smoking, we can catch them early and do something about it.
Low-dose CT scans are recommended for anyone age 50 to 77 who has at least a 20-pack year history. That's the equivalent of having smoked a pack a day for 20 years or 2 packs a day for 10 years.
I've had doctors at Roger Maris, when I was going through chemotherapy, you've got to quit smoking. You've got to quit smoking. Did I listen? No. I was too stubborn of an Irishman to listen. But Dr. Skari just kept hounding me and hounding me and hounding. Tony, you've got to quit that. It's going to catch up to you, and it has.
Hagan, who is now 71 years old, finally quit smoking in 2014. Before that, he had racked up a 43-pack year history. In 2021, Hagan's annual scan found cancer in the upper lobe of his right lung. It was stage 1, and doctors removed a portion of his lung before it could spread. Then last summer, another scan found more cancer, this time in his left lung. He was treated with radiation.
They didn't want to compromise my lung capacity, being they'd already taken 40% of the right. They didn't want to jeopardize taking any more if they didn't have to.
Hagan credits his scans with keeping him alive.
How do you know when you're going to get pneumonia? How do you know you're not going to be in a car accident? You don't. But the thing you can do is catch it early. How do you do it? Scans. That's the only way around this.
He also believes his relationship with Dr. Skari was crucial.
He tells you how it is, but he also kind of gives you that comfort and feeling that it's going to be okay.
After 15 years as his friend and physician, Dr. Skari feels incredibly connected to Hagan as well.
The goal of family medicine is to have long-lasting relationships with our patient, and Tony is kind of epitomizes that. I think I owe you a steak dinner, my friend. We've had a good relationship, and even though we talk about cancer sometimes, most of the time we give each other a hard time and enjoy each other's company. It's more like talking with a friend than it is actually, sitting down and doing a job.
These two have worked together to save a life and a friendship, one scan at a time. In Jamestown, Jason Anschutz, Sanford Health News.